Ilia aflibercept injection for the treatment of neovascular age-related macular degeneration. Recent therapeutic advances in neovascular age-related macular degeneration, or wet AMD, have focused upon an angiogenesis promoter, vascular endothelial growth factor A, known as VEGF-A. Clinical studies have shown that inhibition of multiple isoforms of VEGF-A led to a delay in progression of vision loss in many patients, and in some patients, improvement in vision while on treatment. However, historically, studies showed that maintenance of vision gains required monthly office visits and injections, posing challenges for patients and their caregivers. Investigation of the role of VEGF-A and its complex interactions with other growth factors, such as placental growth factor or PLGF, another member of the VEGF family that binds only to VEGF receptor 1, present on the surface of vascular endothelial cells and leukocytes, has led to the development of additional therapeutic options for the treatment of wet AMD. Let's take a closer look at the biologic underpinnings of neovascular or wet AMD, which, if untreated, can rapidly cause severe central vision loss. The multifactorial pathogenesis of wet AMD reflects the complex interaction of environmental factors, aging processes, and genetic susceptibility. It is characterized by choroidal neovascularization under the retinal pigment epithelium, or RPE, and retina, which can lead to hemorrhage, retinal or RPE detachment, disciform scarring, and retinal atrophy. Wet AMD's development signals a failure within the complex functions of the retinal pigment epithelium, or RPE, nourishing and protecting the photoreceptors of the neurosensory retina. In the healthy retina, tight junctions between RPE cells establish the blood-retinal barrier that maintains a fluid-free subretinal space and metabolic homeostasis. In the aging eye, chronic oxidative stress is a prime culprit in promoting drusen formation, RPE dysfunction, and disruption of RPE cell integrity. Oxidative stress itself, as well as pro-inflammatory factors present in drusen, can induce the secretion of angiogenic factors such as VEGF, and promote choroidal neovascularization with the newly formed vessels growing through breaks in Bruch's membrane to populate sub-RPE and subretinal spaces. These vessels are fragile and highly permeable, leaking fluid and proteins to cause vision-threatening retinal edema and hemorrhage, the clinical hallmarks of wet AMD. It is in these early stages of wet AMD when acute vision loss is due largely to edema. VEGF-A isomers, including 121 and 165, are critical to pathologic choroidal neovascularization. The biologically active dimeric forms of these growth factors bind to dimeric VEGF receptors 1 and 2 present on the surface of choriocapillary's vascular endothelial cells, activating their proliferation and migration. Although a precise role continues to be investigated, recent research also suggests a potential role for PLGF through its activation of VEGF receptor 1 in promoting pathologic angiogenesis and vascular permeability. Ilia, or aflibercept injection, is indicated for the treatment of patients with neovascular or wet AMD. Ilia is also indicated for the treatment of macular edema following central retinal vein occlusion. Ilia is contraindicated in patients with ocular or periocular infections, active intraocular inflammation, or known hypersensitivity to aflibercept or to any of the excipients in Ilia. Ilia is a recombinant fusion protein consisting of portions of the human VEGF receptors 1 and 2 extracellular domains fused to the Fc portion of human immunoglobulin G, which acts as a decoy for the natural receptor necessary for binding of VEGF-A and PLGF dimers. Aflibercept is produced in recombinant Chinese hamster ovary cells. Ilia binds multiple isoforms of VEGF-A and PLGF to prevent their interaction with native VEGF receptors. With its trap design, Ilia binds active dimers in a precise 1-to-1 ratio, like two hands clasping a ball, reducing risk of aggregation. Ilia is a purified and formulated preparation of aflibercept, specifically for intravitreal injection. Ilia is formulated as an isoosmotic solution compatible with the intraocular environment. Intravitreal injections, including those with Ilia, have been associated with endophthalmitis and retinal detachments. Ilia is the only VEGF inhibitor approved for every 2 months dosing following 3 initial monthly doses. Important prescribing information for Eylea aflibercept injection. Eylea aflibercept injection is indicated for the treatment of patients with neovascular wet age-related macular degeneration, AMD. The recommended dose for Eylea is 2 mg administered by intravitreal injection every 4 weeks, monthly, for the first 12 weeks, 3 months, followed by 2 mg once every 8 weeks, 2 months. Although Eylea may be dosed as frequently as 2 mg every 4 weeks, monthly, additional efficacy was not demonstrated when Eylea was dosed every 4 weeks compared to every 8 weeks. Eylea is indicated for the treatment of patients with macular edema following Central Retinal Vein Occlusion, CRVO. The recommended dose for Eylea is 2 mg administered by intravitreal injection every 4 weeks, monthly. Important safety information for Eylea aflibercept injection. Eylea aflibercept injection is contraindicated in patients with ocular or periocular infections, active intraocular inflammation, or known hypersensitivity to aflibercept or to any of the excipients in Eylea. Intravitreal injections, including those with Eylea, have been associated with endophthalmitis and retinal detachments. Proper aseptic injection technique must always be used when administering Eylea. Patients should be instructed to report any symptoms suggestive of endophthalmitis or retinal detachment without delay and should be managed appropriately. Intraocular inflammation has been reported with the use of Eylea. Acute increases in intraocular pressure have been seen within 60 minutes of intravitreal injection, including with Eylea. Sustained increases in intraocular pressure have also been reported after repeated intravitreal dosing with VEGF inhibitors. Intraocular pressure and the perfusion of the optic nerve head should be monitored and managed appropriately. There is a potential risk of arterial thromboembolic events, ATEs, following use of intravitreal VEGF inhibitors, including Eylea, defined as non-fatal stroke, non-fatal myocardial infarction, or vascular death, including deaths of unknown cause. The incidence of ATEs in the VIEW 1 and VIEW 2 wet AMD studies in patients treated with Eylea was 1.8% during the first year. The incidence of ATEs in the Copernicus and Galileo CRVO studies was 0% in patients treated with Eylea, compared with 1.4% in patients receiving sham control during the first 6 months. The most common adverse reactions, greater than or equal to 5%, reported in patients receiving Eylea were conjunctival hemorrhage, eye pain, cataract, vitreous detachment, vitreous floaters, and increased intraocular pressure. Serious adverse reactions related to the injection procedure have occurred in less than 0.1% of intravitreal injections with Eylea, including endophthalmitis, traumatic cataract, increased intraocular pressure, and vitreous detachment. Please see the full prescribing information for Eylea. Ilia was discovered and developed and is marketed in the United States by Regeneron Pharmaceuticals, Incorporated.